how Hospital Clínic Barcelona is leveraging strategic partnerships to advance care within your market?
This is super important, and I always like to say that the CE clinic is for collaboration. We strongly believe that if we want to take good care of our patients, one hospital is not enough. We need to do more things, right? We have 4 strategic alliances or strategic partnerships that are very central to our operations. One of the very nice tech transfer stories of Europe, where things started as research on our research foundations. We were very successful. We raised the money. This we translated into the clinic. We decided we can treat patients because we have something called a hospital exemption, that we can treat patients with these things. Then we pass all the regulatory things at the European level. We now approaching more than 600 patients being treated by our two CAR-Ts, right? Very important. We are selling also to other regions in the world. We believe that if we want to get the best care out of patients, we really need to collaborate with anything. It can be primary care, other hospitals that are different from us and things that we don't have, like pediatrics and maternity care, but also patients and regional. We work with governments in Europe and elsewhere in the world, right? We just try to reach patients and try to make the best of them.
Welcome to the Analyzing Healthcare podcast, brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. All right, welcome to the next Scale Community Analyzing Healthcare podcast. I am pleased to be joined by Jorge Fernandez, the Chief Innovation Officer at Hospital Clínic Barcelona. So coming from live from Barcelona, Spain today. Jorge, welcome to the podcast. Thanks so much for being here.
Thank you very much for having me. It's a pleasure.
So maybe we'll just begin with a quick introduction to Hospital Clínic Barcelona. Would love to just get a flavor for the hospital system.
Absolutely.
In terms of size and scope of what you cover.
Absolutely. I mean, there's more things than, let's say, football and architecture in Barcelona. And Hospital Clínic de Barcelona is a top public tertiary hospital, usually ranked among the top 50 in the Newsweek rankings, hospital rankings of the world, right? Very strong position on oncology, neurosciences, and cardiovascular, and as well as in advanced therapies. So we have probably the largest and the first and the largest producer of CAR-T therapies being administered to patients from an academic medical center. In Europe, for sure, we know that, but we think also in the world. So we're competing head-to-head with pharma companies.
And give us a sense for the size. You mentioned top 50 in the world, so I imagine quite large, but in terms of beds, patients?
Sure. So we have 3 top locations, multi-site hospital. The novelty of it is that in the next 10, 12 years, we'll be moving to a new location because we've gone so far. We're sitting in the middle of the city, 150 beds, 150,000 operate more than 1 million patients per year, quite a large facilities.
Wonderful. So quite a large facility in Barcelona. So lot to explore. Maybe before we jump into your role as Chief Innovation Officer at the hospital, we can step back as we typically do on these global podcasts and just have a very quick primer introduction to healthcare in Spain, which is not really a fair topic to cover in a few minutes, but just for those that are living internationally and don't have the luxury of living day to day in Spain, give us a sense for Spain's healthcare system structure. Is it mostly private? Is it mostly public? And give us a sense for some of the key trends that at a national level you're seeing and that at a national level you're focused on in terms of the next 5 years outlook.
Very good. So in terms of the healthcare system, it's mainly a public health system for international audience, very similar to the UK NHS, the National Health System. The novelty in Spain is that we have 17 regions, 17, we call them autonomous communities. And reality is that healthcare is decentralized to these 17 regions, right? So everybody has their own budget and is responsible for certain things. This is positive on one side, because things are closer to the patient, right? It is negative on the sense that you have 17 different regional systems. And this is also, complained also from pharma companies, medtech companies, startups, because they need to deal with different people, okay? These are large public officials. Some of them sometimes change jobs, you need to build the relationships, etc. Okay? So that's the thing. In terms of the 17 communities, there is one that is very different, which is Catalonia, where Barcelona is based. The other 16 play a similar role in terms of hospitals, meaning that it is the government who owns the hospitals, the regional governments who own the hospitals. They have the power, the elected politicians have the power to take off CEOs of hospitals if they want. Okay, so that's a bad part if you want to call it this way, right? In Catalonia, there is more of a mixed picture in the sense that there is a large group of hospitals. It's 70 in total, right? It's a 8 million community, but basically those 70 hospitals is structured. They're 100% public. We have 8. Then we have a group of them that are public, but they're not governed or owned by the government. But basically, the activity is mainly financed by the public money. Okay? So if you ask people in the street, for them, some of these mixed hospitals, let's call them this way, they feel public because they go with their national security card. Everything for them is like a public hospital. Okay. And then we have a group of private hospitals as well, usually divided in between large corporations, 6, Quirónsalud and others, and then some small-sized hospitals, let's say private hospitals, right? The typical person has as a right the let's say access to the public systems, and this is where if you have something big, you go there. If you have a cancer, or if you have something that is relevant, you'll go to the public system. You use the private system for speeding up certain things and for convenience. Okay, most of these things, right? And in Spain, there is what we call double coverage. Let's say roughly between 20 and 25% of the population we have this double coverage, which means you have as a right the public system, but also you pay a private healthcare insurance to get access to those public hospitals, right? It is very different from the US in the sense that prices are, let's say, very, very convenient. What we pay here in a year is what you pay in the US for a month, more or less. Okay,
And
something like that.
you mentioned about that it's largely public. Obviously, there's a slightly different model in your Catalonia, but you mentioned that it's public, and so it sounds like it's publicly funded. And it also sounds like in most of the provinces or the regions that it's publicly owned hospitals. If you go to see a specialist like a cardiologist or you go to see a primary care physician, are those providers also employed by the government like they are employed by the NHS? Or are they
Yes, exactly the same
they're
thing. In
employed
the
by
public system, we have these 2 layers. One is, it's very similar to the NHS. You see your primary care physician. Most of them are public officials. That's the first thing. And then if that's needed, they send you to the hospital, right? In these public hospitals, these 8 hospitals, at least in Catalonia that I mentioned, they are again public officials. In the other, they are not public officials, although people feel like that they are in a public hospital, right? But that's a little bit like the mix.
You've mentioned hospitals a number of times. Is most of the care provided at the hospital setting, or is there a robust non-hospital market for cardiologists,
there is a very robust primary care setting, okay? And truly, we get a lot of our care there. Of course, for specialty care, we go to hospitals, but for a lot of the things, primary care works well. One of the problems we have now with primary care is that they're overburdened in terms of work because population has grown, chronic diseases, more multimorbidities, etc., and that makes that these patients create a huge burden for the amount of physicians available in the public system, both at the primary care and at the specialty.
Interesting. That's one difference that I hear. I mean, there are a couple key differences when I compare it to the U.S., but one of them is the specialists. There's a large portion that are employed by hospitals, but there's also a large portion that is independent from hospitals. So that is interesting. So yeah, thanks for that. And maybe we'll now segue to your role as Chief Innovation Officer at Hospital Clínic Barcelona. Let's start at the top. Let's maybe just give us a glimpse under the hood of what the role entails and what the key priorities and focus areas are, what innovation means to your institution.
Very good. One of the, I'm going to call it innovations in my position is that I am not only the Director of Innovation for the hospital, but I'm also the Director of Innovation for 3 other institutions that are part of what we call Campus Clínic Barcelona. basically a set of institutions that have the hospital and at the university at the center. There are two research foundations. One is called EDBAPS, which is the research foundation of the hospital. Then we have another research foundation for global health topics, so malaria, dengue, and these type of diseases and conditions. This is a joint venture with Fundación La Caixa, which is a top bank here in Spain. Right. And then we have a private not-for-profit organization where we have certain things that we cannot do as agile in the other public settings. Okay. This is unique in the sense that normally in Spain, but also in Europe, you will find these type of institutions 3 or 4 directors of innovation, one in each of the institutions. In my case, I am responsible for driving the innovation agenda in all these 4 institutions, right? Which is, of course, a beauty in itself, but also a challenge because I have 4 bosses. I mean, I have to coordinate more people, more activities. I mean, it's more challenging, let's say. But I think overall means that, you get to understand innovation end to end, let's say. And in terms of priorities, I can share with you how we understand innovation here, right? Innovation is one of these words that mean many different things to many different people, right? And it's always good to make a differentiation. For us, innovation means the ability to accelerate things that are happening already. So things that are happening, that they happen faster, and things that are not happening, that they start to happen. The bulk of our work is these 2 things, okay? How do we structure the work? We have a model of innovation based on 3 things, okay? I don't know how to call it, three areas, I'm going to say, okay? The first thing is what we call in-out. Basically, this means spinning off companies. Mm-hmm. Our innovation department was created close to 20 years ago. And in this journey, we have created more than 30 companies, okay, 30 spin-offs, 30 startups, right? Some of them are dead now. Some of them we have sold our participation there, right?
And are those
Some of them are
those
still
30
running.
companies, are they mostly life sciences companies where you've done research on a therapeutic area, or are they technology companies?
Everything. We have, let's say, we have biotech companies coming straight from our research, right? That's the first thing. And then it can be anything from cancer to cardiovascular to neurosciences. So we have it really depends where we have top people. That will be the key differentiation. That's the first one. We also have medtech, devices in general, usually not large devices, more not consumer devices, but what we call medical devices. And then the third, recently, a lot of it is becoming digital health, let's say. Okay. Roughly, I would say that is 30, 20%, 50% more or less.
And within the digital health space, would love to hear just an example or 2 of what you've focused on or what you've spun out in that space.
Yes. I mean, can be things, for example, like we have a company called Reveal Genomics. Okay, Reveal Genomics is a spin-off from the director of the Cancer Center, or Comprehensive Cancer Center. Basically, is a platform at the intersection of genomics and artificial intelligence for women with breast cancer. Okay, to provide better diagnosis so that the treatment can be more personalized. That's, for example, one of the typical things that it's at the intersection of science, but also on the digital side, for example. That would be one of the examples, right? We have another one who just recently sold to a Dutch company, which is a system for managing hospital operations at the hospital, right? What we call these days non-clinical AI. Let's say, when are patients entering the operating room, at what part of the operating procedure they are in. So this on one end serves as a communication window to the patients or to the families waiting outside. So across the hospital, we have different screens, and then you can see where exactly at what stage of the process is your family member, right? And then this creates data that allows us to manage, or at least try to manage more efficiently, the operations in all the surgical procedures.
It's interesting as I'm listening to it because there's such a heavy focus on public, right? Public funding, public employment of providers. And yet really when you get into this topic of innovation and your purview, there's a heavy collaboration between public and private, right? On the public side, you're incubating, you're sort of coming up with ideas about what's working, what's not working based on your patient population. But as those ideas manifest, you're then spinning off to, it sounds like, the private sector. Is that right? That these would then be spun off to the private?
Not only that, for this first piece that I mentioned you, the in-out, these 30 plus companies that we have created, they require funds like any other startup. right? So we help them connect them with the, on one end, different public grants that they can, let's say non-dilutive funding, as we call it here, so they can get their products and services farther into the market without losing equity, but also connecting them to venture capital so they can, tap onto private monies, right? Sometimes also one of the target companies where we exit those companies is large corporations. So really, it is, for us, is an ecosystem between public and private. We don't prioritize. Basically, what we try to make sure is that these technologies reach the patients. That's our main goal. Okay, so that will be the number one. We have a lot of companies there. Also, we license our technologies to existing companies, and we have a batch of that where we don't create new companies, right? On the other end, we have, and here, just to be clear, this is a business of 40 to 50 people, right? So we only have 40 to 50 people crazy enough to see patients every day, do research. This is a top research institution, the first number one in the world in Spain and one of the top in Europe. Teach at the same time at university, and then at nights and weekends run your companies, right? So very, very small set of people who are that. That's on one set, what we call the in-out. If I move to the other extreme, we have what we call the in-in. Here, the goal is not to create companies, but to solve problems that we have. And that's very important. Some of those problems, people on the ground, they solve it themselves. They don't need the innovation. So basically, we don't require that everything comes through us. Not the case. What we normally do is we try to tell them, so if there are certain things that you're doing that are relevant projects, let us know, because then we can serve as, let's say, an amplifier of your message when we do presentations outside. Sometimes we are brand ambassadors. When we get people that come and visit us, they normally don't talk to us about what are you doing good. They want to see is what are your new things, right? And then we can able to present those things, right? And also we can help to get funding to continue these projects, okay? But basically our goal is not to create a company, it's to solve one of our problems.
And what's an
The
example of
innovation department works very well here. We're in two areas. One is digital transformation and AI projects where, of course, we need to digitize certain things, or we need to incorporate artificial intelligence into this, or projects where there is a need for, let's say, knowledge that our clinicians and our researchers are not well aware, meaning regulatory, legal, business, these type of knowledges that they are short on, let's say, right? So that's where we enter. This is a business of the close to 9,000 people we are here, right? And then basically our goal here is to try to be like what Toyota says. Toyota says that every Toyota worker has two jobs. One is to do their job, and the second is to improve their job. In public institutions in the past, we've put a lot of effort into making sure that people were doing their jobs, right? And not enough in making sure that those who wanted to improve their jobs could do it. And that's what we try to do. So if people have ideas on how they can improve certain processes, certain pathways, certain whatever that is, it can be clinical or non-clinical, we try to support those so they have a pathway to do that, right? So really anybody can be an innovator here, let's say, right? And then in the middle, we have what we call the out-in, which basically this is companies from the outside who want to work with us. This is not European projects or national projects. We have also lots of those. This is not market access projects from pharma companies, from medtech companies, which we also have a lot. This is about co-development of projects, meaning there is a company in the outside that they have certain assets. They want to work with us. Usually the connection point is one of our KOLs. Usually a KOL is someone who, for us, is well known at the international level, either the headquarters or at least the European level. And then these companies want to work with them. It could be for developing a new device. It could be for developing a new software. It really depends, right? We have, let's say, roughly 300 key opinion leaders in our institutions, and that's what we have identified, let's say. And then we get these type of connections with them. And every project here is different because the type of assets that the external company and that the hospital puts on the table is always different, let's say.
When you look at the three, the in out, in, and out in, how do you allocate your time between those three buckets? Is it primarily in? We mentioned 9,000.
Yes. I'm going to be talking only about, let's say, my time and the time of my team, right? For in-out, it really depends a lot on the moment of the year. We have our institutions, because of the laws that we have in our countries, they need to take participation in those companies, and for that they need to they need to get approval at the respective management meetings, which happens twice a year, December and June. Usually, right? So the months before that, there is heavy workload on that. Usually in a normal year, we create between 2 and 4 new companies. Okay, this year we're going to be doing 3. It's an average year. Okay, so that's one thing. For the sometimes it's heavy, but there is more of the work being done at the front lines that I'm really not aware. So there's lots of innovation happening at the hospital that is not centralized through us, which is totally fine. We don't want to centralize everything because what our point is, hey, if you can do it yourself, if you can improve, if you can get things better, go for it. You don't need to go through us. Again, if it works well, if it's successful, talk to us, because then maybe we can scale it. We can find funds. We can support you in different ways, right? But you don't need to talk to us, right? That's very important. So that's heavy. And then one in the middle, it depends. Right now, for example, we're working with a top medtech company developing a global software. Well, that's taking most of my time, for example. So I don't think it's 1/3, 1/3, 1/3. Things usually, depending on the time of the year, is more 50% or even 70% of my time is dedicated to something. And then the rest of the time I allocate it to the others. Overall in the year, probably is 40, 20 or something.
Understood. I would love to dig into the in a little bit more and just get a couple of examples of initiatives where the team across your 10,000 employees have had pain points in the business or areas for opportunity, and your innovation team has helped to create change and accelerate performance.
Yes. Let me put, for example, a couple of examples, and both of them are coming from our innovation awards, right? So we have an innovation award that every year we run it. It's like a normal call for projects. The only thing is that it's only projects from our 4 institutions that I mentioned. Here, the idea is that we offer 3 prizes of 30,000 K for late stage projects, 15,000 euros for 3 projects for early stage, and for 2 projects for what we call internal improvements, the in that you're mentioning, right? Plus the commitment of the management board to make these projects a reality. Okay, and I'm going to put a couple of examples from previous years. The first one is called moving inside the clinic. Let's put it this way, motel clinic. Okay, what is this? This is the rehabilitation team reaches to us, and then they say, hey, we have a group of patients that they go under surgery, and basically once they got this, we told them, hey, you should move your body. But what happens is that we tell them to stay in their rooms for 24 hours. Okay, so it's really a contradictory. So the innovator, in this case, the head of the department, says, hey, why don't we use, our long corridors, right, to try to do certain activities of, let's say, gamification of exercises that our patients can leave the rooms and they can do these things. And we are creating, let's say like a game where they do certain exercises. Now is mostly non-digital. The idea is that for the second stage is that we transform this into digital activities as well, right? But the idea is that these people can do certain physical activities in the hospital so they feel better and they can go home earlier. Otherwise, they stay usually, let's say, between 5 and 7 days in the room. So that would be one of them. Second project would be what I call the relaxing. I'm going to call it like this. Okay, this is a project coming from a group of nurses at the hospital that they have realized that their patients are nervous for certain things, right? And they think that they can use virtual reality, typical Oculus classes, certain content to offer this type of relaxation to patients, so they relax and the procedures can be done to them. Okay, the project is called Serenamente, and it's just been awarded a couple of weeks ago in recent projects, right? So that's a little bit the approach that we have. And then the second project would be what we call, it's been just awarded a couple of weeks ago in a innovation words. It's called Serenamente, peaceful, right? And what is the need here is a group of nurses that they realize that for certain treatments or certain tests that they need to perform, the patients are nervous, right? And they think that maybe using some type of virtual reality that, we can use, we can, relax. It is very cheap because you just need an Oculus or similar glasses, okay? You don't need to create any specific content. Free libraries that basically that you try to do is distract patients from that. It works very well. We've tested it. We're very happy about the future. So these are the two types of things where basically we involve technology, but it comes from a problem that our clinicians or our nurses have. And what we try to do is we try to work with them to try to make sense of some, improves patient care.
Do you have a large technology team on staff that's handling this, or is the development work mostly outsourced to a third party?
We mostly outsource a lot of these things. So a lot of the, let's say, the monies of the awards, they usually go to these type of things. So try to find the right type of players that they can either buy, for example, buy 2 or 3 Oculus glasses, and then help them to try to make everything in place so that it works. But no, we don't have we have a large team that is dedicated for the clinical operations, the clinical IT of the hospital itself.
Healthcare leaders, if your revenue cycle management is underwhelming you, it's time to rethink your current suite of solutions. Scale Healthcare's AI-powered RCM solutions are purpose-built to protect and accelerate revenue across the entire lifecycle. Denial Shield is an AI solution that proactively prevents and automates the resolution of denials, stopping revenue leakage before claims are even submitted. Front Desk Shield supports preclinical, administrative, and front-end RCM functions, incorporating eligibility, prior authorization agents to eliminate friction early in the patient journey. Revenue Shield maximizes revenue by automating coding, charge capture, and revenue integrity functions, ensuring accurate and complete reimbursement. Together, the Shield suite helps organizations reduce operating costs, capture missed revenue, accelerate cash flow, and increase productivity without ripping and replacing existing systems. If you're ready for immediate ROI and measurable impact, visit scale-healthcare.com and see how the Shield suite is redefining AI-powered RCM. So I want to take a step back now and talk about sort of the culture of innovation at your institution, because my experience with public systems is that they're not known for being great innovators, frankly. And I think you sort of alluded to this as well in terms of managing the day-to-day was the core focus for many public institutions. And yet the way that you speak and the way the program you're describing, it sounds like innovation is very core to Hospital Clínic Barcelona and very much infused across the organization. It's not just a centralized function. It's really living and breathing through this in program across all the tentacles of the organization, which is unique for a public business, a public organization. What is it that's allowed innovation to infiltrate the culture of this organization so well and so broadly?
I think it is, I'm going to say there's 2 things. One is the fact that because we are in the same facility for the last 120 years, so let's say our spaces, our pathways are not ideal, okay? And that has forced a lot of our people to think of better ways to treat patients, right? Why is that? Because the type of doctors we have here, they're top doctors, right? So they really want to do the best for the patient, right? And then in the end, what it is just the way forward. That's the first thing. The second is that a lot of these things come straight from research, right? To try to answer questions where we don't have answers, right? And the hospital has a strong research culture. I mean, I've worked in other hospitals before, and I had prior to this position, I was director of innovation for PAT Health, which is a large European Union agency. And so I know very well the hospital and the healthcare space in Europe. The fact that some hospitals are strong in research facilitates that some innovation goes into that. Of course, you cannot mandate innovation. You need to facilitate. You need to force it. You need to So there are processes and things that we need to do. But the fact that you have the knowledge repository of things that come from research helps to gather this idea that hey, we can answer questions differently. Hey, we can improve the way we treat patients in order to look for better patient outcomes.
How much of your focus on innovation relates to cost efficiencies on the cost of care? Big topic in the States about reducing the cost of care, managing the cost of care in a number of countries. I didn't hear that in the areas of focus. Is that a core focus?
Arnold, I would say it is. I think I didn't say it because it's central. right?
Yeah.
Because when you are a public system, it is more important to reduce costs than it is to improve the quality of care, because the quality of care is already at the top, right? So what we try to do is maybe, make it simpler for the patient and the families, make it simpler for our professionals, etc., right? But in the end, it's one of our questions, when we do our business cases, our user cases, what we try to do is to understand, okay, how much we can save into this. Because I always tell people when we work with external startups, sometimes they come and we are customers of them, but they try to sell us things, right? The first thing I tell them is the thing that you sell, I don't care if you're the best startup in the world, okay? And the second one is far away from you. Unless it improves my operations significantly, this is not for us, okay? Why is that? Because in a public hospital, not just the Clínic Barcelona, but in others, we need to get alignment of a lot of the things. We need to get alignment of the medical director, of the nursing director, of the IT systems, of the legal department, of the patient experience group, right? So you need to get alignment of the finance department to get finance. So a lot of these things, unless it makes total sense for us to put hours into this, right? Then the solution doesn't make sense. And it can be great. I'm not saying it's not great. I'm just saying it is not the right solution for us, right? Part of it is those savings that we are talking about now. And take inefficiencies out of the system. And we have plenty, mainly because of what I said. We are in a location for the last 120 years, and it's not ideal in terms of how we do it.
In this umbrella of innovation, or this portfolio of innovation, and with the goal of cost savings, is there also a push to migrate cases to outpatient procedures? So, for example, the orthopedic joint replacement surgery that was done in a hospital at a higher cost historically is now moved to an outpatient surgical center. The cardiology procedure that was done in a hospital is migrated to an outpatient surgical center, or that's not really a core focus?
No, for us, it's not core because our length of the stay is really reduced. We're talking about 3-4 days, really not a lot. Of course, for certain conditions, longer. Okay? But let's say the majority of our patients don't spend a lot of time at the hospital. But it is true that there's a big trend here for us is what we call home care. So try to bring patients, instead of having them here, having them at their own houses, at their own homes. Right? Why is this important? Because it's also cultural, right? In the past, basically, we were operating people and having them at the hospital, and we would only use, let's say, the home care facilities, let's say the home care possibilities, once the hospital was full. And now what we're trying to work is precisely on the idea, no, this is another unit that we have. And hey, maybe we have the hospital unit empty and there is more people outside in homes, but this is cheaper for the system and we can handle it, right? This is a cultural thing, cultural change that we need to operate into our daily operations, but it's not, we don't do that. Let's say we have let's say what we do is, let's say we have connections with hospitals from other locations here in Catalonia. And then, yes, we try to facilitate certain things, for example, for oncology, that they don't do their chemotherapy. I mean, some patients, they need to come to a hospital, right? Imagine that they have 35 sessions, okay? And they live an hour away from us. Let's say, basically they lose a day every week, let's say, just coming for the treatment, right? We are working with hospitals near where these patients live so they can follow those treatments there as safely and as securely, being followed by the doctors from hospital.
Do you think, so in the States, it sounds like the length of stay is relatively contained. So I take that point. But in the States, the private market has accelerated a space for outpatient procedures at a lower cost of care. So instead of 3 to 4 days, same day procedure. Hospitals have done that too. Hospitals have adopted outpatient procedures. So it's not exclusively non-hospital market, but the private non-hospital market has, I would say, accelerated that. So that's another role that I think, the private sector has helped play. Do you think Spain maybe doesn't take as aggressive of a stance on the migration to outpatient because it is so heavy focused on public, or you view it differently?
That's a good question. I think it has to do with the fact that for certain procedures, certainly, we have moved away from patients staying at the hospital. But basically, what we have to do is improve our processes so we can send our patients home earlier. Not having a different facility where these things can happen at a low cost. Okay, so I guess the philosophy is the same, trying to provide the same level of care with less cost. But in our case, what we try to do is discharge patients earlier. Of course, not for every condition we can do that, but for as many conditions as possible. For example, there's tons of conditions that before it represented 2 or 3 days at the hospital. Now they get in, and then they get out and they sleep in their own houses, right? But I mean, I think it's the same process or the same strategy, but without the need for external facilities, which is what I understand is more common in the US, correct?
Yeah. Yeah,
Understood. I
that's
think
right.
there is a difference here.
I want to finish up on the theme of strategic partnerships. When we talked previously, you had mentioned that there were a couple of strategic partnerships, hospital to hospital network, and then also hospital to primary care. And for us, the theme of strategic partnerships is very front and central in terms of the evolution of the healthcare market. And so we'd love to hear how Hospital Clínic Barcelona is leveraging strategic partnerships to advance care within your market.
Absolutely. This is super important. And I always like to say that the CE clinic is for collaboration. And why is that? Because we strongly believe that if we want to take good care of our patients, one hospital is not enough, to do more things, right? We have 4 strategic alliances or strategic partnerships that are very central to our operations. The first one is with primary care. As I mentioned before, for the last 20 years, we've been working with our primary care to try to facilitate the process. So basically, we try to make sure that what the primary care sends to the hospital is the right type of patients at the right point in time. Okay, very important. This is very important because we don't have ownership over primary care. We don't have anything, but basically we have decided strategically to work with them to try to simplify this process, right? There's more than 40 groups for 40 different conditions that work together. And this means that close to 150 the doctors go see patients in primary care. So specialist doctors that they go to see patients, to train those places to make sure that, that the processes are well processed, well established, and well connected. So that's the first strategic partnership with primary care. The second, as I mentioned before, is with other 5 hospitals. It's a hospital network that we have here with other 5 hospitals in the region of Catalonia. Okay. What is the main challenge that we have not only in Catalonia, but in Spain, and I would say in Europe, which is the shortage of certain doctors, right? Specifically for, let's say, rural areas, right? It's very easy to find doctors in Barcelona, let's say, but when you move far away from, these big cities, it becomes more difficult, right? And what we have done is created this type of alliances with these hospitals where we train them, we share with them our knowledge, etc. Sometimes we recruit doctors, so they spend 3 days with us and 2 days with them. So basically, we make sure that we offer them professional advancement in the sense that they have everything to see top patients and to do research at a top facility, but we also make sure that they see patients at these rural areas. They're very important. Otherwise, for those people, it gets very difficult to attract top talent to work maybe 150 kilometers from Barcelona, for example. So that's the second strategic partnership around hospital alliance, as we call it, C17. This is the name of the road that gets into Catalonia. Okay? And these are the hospitals that are connected to it. So that's the second one. The third one is we have a historical collaboration with Hospital Sant Joan de Déu, which is a pediatric and maternity care hospital. Basically, they are our pediatric maternity care hospital. We have certain things still, but basically, pediatric patients, they are treated there, right? And then, of course, there are certain things, that sometimes the expertise stays here. We have the machine, right? Maybe there's a robot. We have, for example, a very important cardiac surgery unit, unique in Europe. Okay, so the equipment stays here at the hospital. The doctor is an employee of the hospital, a clinic, but basically we treat patients that are pediatric patients, but the follow-up takes place on the pediatric hospital. So we make sure that there is this continuum of care between pediatric and adults, okay? Both when they turn 18, which is the age where here in Spain you turn an adult, and then the second also for knowledge sharing, right? In some cases, you might have certain amounts, etc. And then the fourth, we have a network of 13 hospitals in Spain and some others across the world as well, regions and hospitals, where basically we offer our two CAR Ts technologies that I mentioned before. We have, I think it's one of the very nice tech transfer stories of Europe, where things started as research on our research foundations. Then, we were very successful. We raised the money. This we translated into the clinic, and we decided, hey, maybe we can treat patients because we have something called a hospital exemption, that we can treat patients for these things. Then we pass all the regulatory things at the European level, and then over the years, we now approaching more than 600 patients being treated by our two CAR Ts, right? Very, very important. We are selling also to other regions in the world. Okay, so this will be the four areas where we play a strategic partnership. Just to let you know that you said that this is important for you. For us, it's super important. Why is that? Because we believe that if we want to get the best care out of patients, we really need to collaborate with anything. It can be primary care, other hospitals that are different from us, and things that we don't have, like pediatrics and maternity care, but also patients and regional. We work with governments in Europe and elsewhere in the world, right? So, we try to collaborate with everybody who really shares our same mentality. We just try to reach patients and try to make the best of them.
Jorge, I want to thank you for a really fascinating conversation. It sounds like a great program that you have at Hospital Clínic Barcelona, and I really appreciate you taking the time out of your day to share with us.
Thank you very much, Jason. It's been a real pleasure, and looking forward to the future.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.